welcome to the Get to Know broadcast. I really appreciate that you took time to come and join us. And we're here this evening. I have a really interesting doctor with us this evening. We're going to be talking about diets and what we can do to lose weight, get back. I've got a little bit of a spare tire. I'd love to get rid of that part. And we've been talking about that with Dr. Bernstein. He is actually from Toronto, Ontario, which is pretty cool. I mean, we're both Canucks, and so that's what's fun. But I've been here in America for a long time, but I appreciate the fact that you've taken time to come and join us. I won't tell you a lot about what his background is or anything. I'm going to let him do that, and I've got him in the studio, and I'm going to bring him on right now so that you can meet Dr. Bernstein. Greetings.
Hello, Stephen.
Hi, how are you? Yes.
Good.
Awesome. Thank you for joining us. I really, really do appreciate that, Dr. Bernstein. So you're going to talk to us tonight about our diets. And I'm planning to take notes and learn some things too. Because, the more that I can know about healthcare, the better off I am. And I know that actually what we eat is super important. And I've tried to be much more cautious about the things that I use. But maybe you can start by telling us a little bit about yourself and why you got involved in the medical field.
Well, first of all, I'm a physician. I graduated at the University of Toronto as a family doc a long time ago, in 1966, and opened up a solo practice in downtown Toronto and dealt with family patients, etc. But as I was treating these patients, it soon came to be aware that about 50% of my patients had to lose weight. They had high blood pressure. They had to lose weight to bring them down healthier. The diabetics needed to lose weight to get healthier. Cholesterol problems, heart disease, many issues. And in those old days when we went to school, we were taught how to use amphetamines, which is for weight loss. And our big lecture was, don't prescribe too many, you're going to create addicts. So I wasn't happy doing that. So I looked around for many other weight loss programs that were available. And I came across one that a doctor in Europe, he was giving his patients some injections for a totally different reason, but he found that they lost some weight while getting this. And I took his program and tried it on a few patients. I modified it a little bit. And I was able to produce, over a few years of managing, I'm able to get something like 75 to 80% of my patients take all their extra weight off, get down to a good, healthy goal. It's much better than any other diet program. Today, even with the new pills or medications and diet regimes, doctors are lucky to get about 15% of their patients losing some weight. And some weight means between 7-8% of their body weight. None of them get patients down to their goal. And so we've developed a program that brings patients down to their goal weight. And then when they get there, we teach them how to eat for a trimmer person. So they have to learn new eating patterns. And they can't go back to eating the way they used to. And a typical example of some of my patients, we do a lot of females as well, Smell, but females mostly. If you take the average girl who's 5'4", a healthy weight range for her is between 120 and 130 pounds. Now, we've had patients come in weighing, say, 200 pounds. If this girl went on to the other diet pills, injections, and such, she'd be lucky if she could lose 30 to 35 pounds, and it would take a year to a year and a half, and she'd have to keep taking medications for it so the weight didn't come back. But she couldn't get below a 35-pound weight loss. So that means she'd be 155 pounds, 165 pounds at her goal. And she'd still be 35, 40 pounds overweight. I can get my patients to lose 30 pounds in 6 to 7 weeks. And I could get this woman from 200 down to 130 and lose 70 pounds in less than 4 months. So it's extremely dramatic. But more important from a medical and patient point of view is we get our patients to lose only fatty tissue and not any muscle or protein. And most every other diet out there, patients can, of the weight they lose, as much as 40% of it is what we call lean body mass, muscle, protein, fluids, electrolytes. And that's where you see people lose a lot off their face and their neck and their shoulders. And they don't take it all off their waist and hips or thigh area. And the problem with that is as soon as they reach a level where they can't lose any more weight and they continue eating, the body reabsorbs the important muscle and protein and fluids to keep them stable. And that's what's called a rebound weight gain. Now, when my patients lose weight, something like 96 or 7% of what they lose is stored fat. And there's only about a 2 or 3% of the weight loss is fluid from shrinking the cells. That's
right. Isn't that what happens in most diets? Is you're just shrinking the cells. You're not actually and that'll cause you to lose weight, but that's how it just comes right back when you don't stick to a diet.
Well, sure. The key is that they're losing muscle and protein and important tissue so that they're metabolically not in good shape while they're losing. And they get a lot of symptoms. That's why they get tired and weak and dizzy and cranky and irritable, lightheaded, and all that sort of stuff. But when you go through a healthy weight loss, you feel well. My patients are not hungry at all on the diet, and they're on vitamins and some trace minerals. So and we give them injections of B vitamins as well as oral vitamins. And that helps, the injections help the fat cells break down faster than normal. And for anybody who's heard the term before, this is a ketogenic diet where patients are put into the state of ketosis. Now, ketosis, a ketone body is just a byproduct of breaking a fat cell down. And it's very close to glucose, which is a sugar that people need for your cells to live on. And if you're not eating sugar, your body can use the ketones to feed themselves. And as you break down fat rapidly, you got lots of food, but it's coming out of your stored fat. And so we like to keep them in a state of ketosis. And the additional vitamins that we use keep them healthy all the way through. Now, when you lose properly, you look, when you're done, you look like you've never been heavy before. The waist, hip, and thighs area lose the weight. And we've had interesting situations where some ladies have lost a lot of weight and they've become models when they're finished. Their skin tone looks very good. And to bring the skin tone into shape, we've had patients who, particularly men that have what's called an apron, a very large abdomen with a lot of loose skin. And they've been told that they should have surgery to cut that extra skin off. But they're too heavy. But when they lose weight with us, the skin in the abdomen tightens up, reabsorbs, and when they've lost 100 pounds, they might look like they've lost 10, but they don't certainly need any surgery.
Yeah, because that is the common problem with most other diets is that, you can be, grossly overweight and then you lose that weight and then you've got these flabs of skin.
Yeah, the skin apron, so to speak.
Yes.
And the reason for that is the protein that holds your skin in good tone, that gets destroyed while you're losing the weight. And so that's why they have that loose hanging skin. They're part of burning up the lean tissue. Okay. Now, another nice, important aspect of what I love with treating patients is their comorbid diseases all improve significantly. For example, every type 2 diabetic, when they've lost 30 or more pounds with us, their blood sugars are normal and we take them off medication. So they're not diabetic anymore.
You mentioned that to me, that with the proper diet that you can get off of regular like pharmacy meds and cure your body so that you I guess you're getting the right minerals and
Proper
vitamins,
vitamins, yes.
and then because of that you can become healthier.
Sure, your metabolism improves dramatically. Um,
Right.
yeah, and diabetes people with high blood pressure,
Mm-hmm.
95% of them don't need medication with the weight loss.
Right.
And some that do need it, they take half the dose that they were on before. So
Mm-hmm.
you remove some of these significant diseases from these people, and you can put a good 10 to 20 years of a healthy life on that person that they never would have had. Because if they left that extra weight, the complicated diseases would end up creating problems. And it's been shown that a good weight loss, 10 to 20 years, is what you can expect to live healthier and longer.
Yeah, that's pretty serious right there, 10 to 20 years.
It sure is.
Yeah.
And another major issue is patients who have heart disease. We've had patients that have been told that they have coronary blood vessels that are partly plugged. They
Mm-hmm.
need to have stents put in. Well, we take these patients, put them on our diet, and with weight loss, the plugs, which are fatty calcium deposits, they get reabsorbed. And every patient that's been told to have an angiogram done and stents put in, we've canceled all
Right.
of them because the blood vessel, instead of being 90% blocked, ends up being about 10% blocked, which is fantastic.
Yeah,
So
that
their energy level, and of course, when your heart is healthier, it's going to help you live longer
right,
and
right.
be physically a lot more active. Um,
Well, yeah, you know, we had talked previously about in this case it's my mother, and she's
yes,
had, well, I mean, she was like just not even there for about a week because of calcium. Her calcium levels were much higher than they were supposed to be, and she was literally not in a coma, but certainly not even aware of what was going on around her.
yeah, pretty close to it. Yes.
Yeah, and so yeah, I'm definitely thinking about her a lot, um, and
Well,
how would your diet help a person that's suffering from very serious illnesses? Well, that in some cases I don't even think the doctors know why. Um, how could you help people?
well, if she's overweight, getting her into a state of ketosis with our
Right.
diet program will help remove the fat. Now, we're talking about fat that gets stored not just in your skin or your abdomen that you can see, but internally in internal organs,
Hmm.
including blood vessels to the heart, blood vessels to the brain. And when you improve them, you get better circulation in your organs and they
Mm.
work better. Um, we always find when patients are in this state with us, um, many of the men will tell me, "Boy, I can focus on my work better. I can remember things better. Um, their memory improves very nicely with a good, healthy weight loss." Now, there's another couple of big more comorbid diseases I like to mention. Um, Patients that have sleep apnea, and
Hmm.
if they're overweight, we know that a lot of fat gets stored in the trachea. And while they're trying to breathe, the trachea won't open up and they don't get the air going into their lungs. Get on a diet and lose weight, and that fat that's stored there gets reabsorbed, and their trachea opens more efficiently, like it was when they were younger. And every one of our patients who's had a CPAP machine don't need them
Right.
anymore. They
Yeah,
stop.
because yeah, that's certainly my mother. As
Yeah.
she's got the breathing machine. She does not sleep well. She is overweight, um, and when I'm curious about when you lose this weight, uh, do you actually like, I'm trying to think of the right words to use. I mean, do you urinate and get rid of it? Is like flushing right out of your system type thing?
Yes, it's a combination of the fat in the form of ketone bodies. Your
Okay.
body, you're breaking, sorry, you're breaking fat down very rapidly. And some of the ketones that are coming out of your fat cell, as I mentioned, they're similar to glucose, so they're absorbed by all your cells of your body and supply food and nutrition to your body cells.
Can
And
you?
the extra ketones that you don't need, your body excretes them through your kidneys. So you
Okay.
can get rid of a lot of fat without having to go to the gym for 10 hours. Okay.
So, see, for my clarification, hopefully for the person that's watching this too, I see these, ketone stuff, but I just really don't know about it. You did explain it already once, but I'm going to ask you to maybe explain it more so that people can understand what are these ketones, how, and you say that they're close to glucose, which is the sugars. Um, how do they affect the body?
Well, first of all, if you eat too much glucose or sugar, your body moves it into your fat cells, and these molecules all combine, the glucose molecules, and you get a big molecule called triglyceride, which is a fat molecule. When you go on a good diet and you're breaking this fat up, the triglycerides break down into small molecules. They're almost the same as glucose, but which means they have 3 carbon atoms in the molecule, and they have oxygen and hydrogen around them, but in a different position than in glucose. And in the different position, they're called a ketone body. So the glucose gets into your body, gets stored, you break it back down again, and you've got ketones. Okay.
Okay.
The nice part about ketones is they can move into your cells to be used as food, and they don't need insulin like glucose needs insulin to get into your cells.
Hmm.
Ketones do not, and they're not
Hmm.
dependent on insulin. So the diabetic finds it easier to be well fed and stable. Okay.
Hmm. Right.
And and the ketones show that you're breaking down excessive amounts of fat, which means you're losing the weight very rapidly.
Mm.
A lot of the products that are out there, um, they're keto friendly, which means they don't have the sugar or the carbohydrates in them, and they should have good levels of protein. But to eat them, you still need to be monitored and tested to make sure you're on a good, healthy diet with these items and that you are producing ketone bodies, which means that you are breaking fat down. Now, it's a simple test to check. The excess ketones get excreted through the urine, and we can do a dipstick in a urine sample and see if there's ketones in there.
I
And
see.
we teach our patients how to do that at home as well as in our offices.
Uh-huh.
And we can make sure that they're in ketosis all the time. So it's
Wow.
just checking. Um, but it's worth having a physician monitor you if you want to go into a ketogenic diet.
Can you tell me what's your take on um I'm going to probably forget the word and I didn't write it down. High fructose corn syrup. It seems to be added to a lot of foods that are out there. And my brother is like, "Oh no, bad, bad, bad." And so can maybe you tell us about sugars, because I think some sugars are good for us, right? And others are not so good.
Well, any sugar depends on what amount that you're taking. If you're taking more than your body needs to burn, then it gets moved into your cells and stored as fat, so it's not good. Whether you want to call it fructose or sucrose or any natural source, just because there are natural sources of sugar means they're not healthy.
Means
And
they're not healthy.
it doesn't mean they're healthy because they're natural sources. Volume is important. You got to keep the
Volume.
volume low. I tell my patients not to have any processed sugar whatsoever. And we keep them off carbohydrates, which are basically complex sugars. Um, because even the carbohydrates you eat, your body breaks it down into sugar, and that stops you from burning your fat up. Okay, so
Right.
so I tell patients to stay away from sugar, period. And in our diet, we allow 2 fresh fruit a day, which gives them about 50, 60 grams of carbohydrate, but it's a complex sugar, fructose, which means it doesn't get absorbed rapidly and moved into your fat cells rapidly. It takes time for your body to digest it, and you're burning it off while you're doing that. So the fructose in a couple servings of fruit is good, but again, only a couple pieces of fruit a day. Too
What
much.
do you tell the person that it's like, oh my goodness, I gotta quit sugars? I mean, personally, I know why I have a spare tire, and it's probably because of the ice cream that I eat, and I love them. I just love it so much.
Yeah.
You know, I just told the person, oh yeah, ice cream, you scream, we all scream for ice cream.
Correct.
But you know, um, what do you say to a person that's thinking that no more sugar? Well, natural sugars and like your fruits, and I think that that's enough, is what you're saying.
Yes.
How do they?
Well,
How can they do this and like be okay with it, right?
first I educate them and tell them about producing ketones, like we've just discussed,
Yes.
so they understand why the sugar should not be taken.
Okay.
Next, when we put them on a diet, because ketones don't need insulin to move in and out of their cells, they don't get low blood sugars, they don't get cravings, they don't get the craving for, oh boy, I could use an ice cream today or a chocolate bar. They don't get that at all, and they can stay on the diet when they're in ketosis, and they can lose 4 to 5 pounds a week, and they know that if they take an ice cream cone, it's going to destroy it for the week. So they're very motivated to get good results, and they're feeling well, and they're not hungry. So
Right. So actually, you think it's a mental thing that triggers you to want to have sugar, or is it because the sugar was
no,
in your system that it's now wanting more sugar because it was in your system and it's not getting it? How?
there's several mechanisms. One of them is if your blood sugar drops into a low normal or below normal, you start to get these cravings for sweets. Now, your blood sugar can drop if you go a long time without eating it, except on our diet, but it also can drop if you're a diabetic and you're taking insulin or pills to keep your blood sugar under control. And if you're not eating properly as a diabetic, your blood sugar can drop too low and create more cravings. Okay. So when we get them into ketosis, the diabetic doesn't need insulin anymore. And so their blood sugars can stay in stable level and not drop. And we monitor them and lower their medication for the diabetes every several days till we get them right off it. So the cravings are metabolically activated by insulin and blood sugar levels, and it's controllable. And you know, when you get a patient on it, when we try them at the end of the first week, they will come and say, I can't believe how well I'm doing. The women tell me they've lost 4 pounds and an inch off their waistline, and they're not hungry. And we put patients on a diet that is about 850 calories. Okay. Many
Yeah, that's not a
patients,
lot.
no, you're right, not much at all.
No.
But many patients tell us they're not hungry. They don't want to eat at all. Okay, because they're just not hungry. And if we have morbid obese patients that have to lose 100 or more pounds, they're taking in about 1,300 calories a day on our diet until we get them down a little lower, and then we drop it. But they're not hungry on it, and the longer they stay on it, the more comfortable they feel.
That's really awesome. It truly is, me, because I know that in the old days, let's just say that, one hamburger from a particular restaurant can run 1,200 calories for that meal. And
Of
it's like,
course.
that's like well over what you even are suggesting. And
Sure.
that's only like one meal.
Yeah, but also bear in mind, it's a hamburger. You've got meat,
Yeah.
fatty, okay, and you want some cheese or something on it, ketchup and mustard. You're adding carbohydrates in that,
Uh-huh.
and from the bread itself, from the hamburger bun. So
I
you're adding calories that are the wrong kind in large amounts.
I see. I see. Yeah. Yeah. I mean, I had to make some major changes, particularly with diet, although I had been on a diet before
Mhm.
and it worked and I lost pretty quickly. And that's why I'm so interested in what you're doing too, as well, because it just sounds like I was impressed that there's no like pharmacy stuff from that aspect of prescription medication as much as the B vitamins and the minerals and getting those things that our body needs
Yeah,
to get healthier. And then the result is much better health. Um,
and
and you're not eating bad stuff anymore
and you're
either,
not getting side effects from medication.
and
The
you're not
diet
getting
too.
tired. Yeah,
Yeah,
exact. That's a really good point.
yeah, it's
Um,
very important because
yeah, I
patients
think
feel
I
well
think
all
that
the
it
way
is.
through. That there was another comorbid disease I wanted to bring up with you. Um, Patients who have arthritis, many of them will have a lot of swelling in their hands, rheumatoid arthritis. Many of them will have arthritis in their back, their hips, their knees. When we put patients on our diet and lose weight, arthritic problems improve dramatically because the extra weight is no longer stressing the joints to the
Hmm.
point where we've had patients will come and tell us that they've got to lose some weight, they've got to replace a hip or a knee. Bad arthritic changes, and the orthopedic surgeon wants to take the knee out or the hip out. With a good, healthy weight loss, every single patient that I've treated, and I'm talking about 800 plus thousand patients over 50 odd years, okay?
800,000 patients.
It's, we have canceled
Wow.
everybody that's been told to have a knee replacement or a hip replacement or back surgery because the weight loss gives them so much better function that instead of going through, say, knee surgery, my patients take an aspirin or Tylenol once every couple of days. That's it. Much healthier than going through surgery. Much easier.
Yeah, I really, well, my mother was just treated for a thyroid condition um, in
Mm-hmm.
her nodules. I guess there's like four nodules on there, something on the
Right.
side,
Yeah.
but yeah, she had to go under the knife, and it's like, oh my goodness. And there's just not much I could do or say about it. But your therapy helps people so they might not even have to have a surgery, right?
Well, no, if they have thyroid disease and they have surgery on the thyroid, it's because there's a swelling and there's a mass there, and
Okay.
that has to come out.
Yeah, and then she had a test, and then to pinpoint where it was, and
Right.
uh, you know, uh, well, she's not exactly young at 80 anymore, but
Mm-hmm.
yeah, she has suffered, but then this is a person that doesn't sleeps during the day and not at night type thing. So I mean, but yeah, recovery has been slow. So
Well,
you are saying that there is a need for certain procedures,
oh, definitely. Depends what they are. Sure. If it's thyroid, you want to make sure it's not cancerous. And
right?
if it's just an overactive thyroid, the surgery taking a nodule out or a lump out of it is very important. But it's a good treatment, but not
Okay.
related to being obese.
Okay. That's good to know. Okay. All right, folks. I'm gonna just go to a commercial break here for just a moment, and Dr. Bernstein will be right back with you. Um, I want to say thank you to everybody that's coming to join me. I do have a few sponsors, and that's what's really awesome. I guess I would probably start with the new rich revolution, that is considering Bitcoin as an investment opportunity. And I recently got involved with Bitcoin Ben, and I'm a member now at his club. He's got 3 clubs now: Massachusetts, St. Louis, and Sarasota. That's where I'm the member. And they're going to be opening up other clubs. I just tell you, I believe in Bitcoin. I think it's going to be the new way that you can get rich. And the thing about what I'm learning, which is it's a learning process, is there's so many people that want to steal your money, but this is not an opportunity to steal your money. This is the opportunity to teach you, because you learn, and then you can earn, and you can grow your income by investing in Bitcoin. And I'm not asking you to invest with me. That's not the deal here. I'm talking invest in Bitcoin, but you can learn through the Bitcoin Ben Club. And just reach out for more information about that. And I'd be happy to share that with you. I think it's awesome. I truly do. Bitcoin Ben is really awesome. He is opening a resort down in San Salvador. Man, I tell you, it's really cool. So think about the investment standpoint, but you know what? You hold the key. You don't spend the money, and you don't put somebody else in charge of your money, and it doesn't have anything to do with a bank. And that's what's really awesome. Um, President Trump, he endorses it, and he's going to back the dollar up with Bitcoin too as well. So it's going to really go up, and this is where the opportunity to earn is. So the other thing I wanted to talk to you about is, if you're thinking about redoing your bathtub or shower or countertops or sink, showers, we have Total Coatings Incorporated, that is local here in Sarasota. So if you're in the Sarasota area, please reach out to these guys. Yes, it's a family business for me. I am a technician there. I was the founder of that company. But you know what? I got involved. I don't get involved in anything that I don't believe in. Number one, this is a product I believe in. It's safe, non-toxic, non-porous, and that's the key, non-porous, because you're not standing or soaking in things that have carcinogens in them, because epoxies and polyurethanes are the other products that they use out there. Those are toxic because they are not non-porous; they're porous. So it's in the water. So if safety is important to you, this is a non-toxic product. Think about reaching out to them. They're a really great company. We've been doing this since 2006. So I wanted to talk about those 2 things for you folks, because I think that they're important. Like I said, I don't talk about things that aren't of value and highly of quality, because otherwise I'm not interested. It's just that plain and simple. All right. So we've been talking with Dr. Bernstein. He's really educating us about a lot of really great stuff. And so let's bring him back in here, and he can continue to educate us about our health and diets, and what we should do to try and become healthier. And yeah, here he is. All right. You're back. Thank you
Hi.
so much.
Good.
Yeah, we've been talking about a lot of good stuff. I was wondering, because I know it's part of your story, is COVID. That affected a lot of people. Well, it affected the entire world. It did.
It sure has.
And you had a lot of clinics in you're in Canada, and that's really awesome too. I love Canada. But you're in America, but you had to close down a bunch of them, and why was that?
Well, we had 70 clinics across Canada
70.
in several provinces. And with COVID, the medical associations closed all medical offices down, the colleges, the physician surgeons, and they would not allow patients going in to see a doctor into a clinic where people were, for the fear of everybody in there picking up infections. So we had to close all the clinics down. And what we've done is we now treat our patients online.
Hmm.
So our nurses will talk to the patients by Zoom calls or telephone calls, and we monitor the patient several times a week over the phone. Um, and we have a physician who monitors every patient to manage all their comorbid diseases and their medications. Um,
Can I ask a question? What do you mean by comorbid?
well,
It sounds like death to me.
well,
What
it
does
is.
it mean?
It's the terminology of a disease that can cause serious complications associated with being obese. So it's
Right. So you're at risk already for maybe some of your conditions.
totally, yes. Bear in mind, if you're overweight, you're not healthy. There are a lot of people that think you can be significantly overweight and your blood pressure is normal and you don't have diabetes, so everything's perfect. Well, it really isn't. And if you stay significantly overweight, the the complication or the disease process will catch up to you sooner or later.
Mhm.
Um, so, just for an example, we have our patients record everything they eat every day, and our nurses monitor that to make sure they're staying on the diet properly and they're not making any mistakes. We have patients do their blood pressures at home. We send patients out to the laboratory to get blood tests done. We'll check thyroid, sugar, cholesterol, some kidney tests, liver function tests, et cetera, to make sure they're staying healthy. And if there's any problem, we will be in touch with their family doc about it, and we will monitor the problem and make sure we get it controlled. So we make sure that they become healthy all the way through this. Okay?
So where do you stand, particularly because I mean, in America, and you guys got shut down a lot longer than America did, um, which killed businesses. I mean, clearly killed businesses.
Yes, yes.
How do you feel about the COVID shot and these immunizations that they've been giving people? And then they came up with, I think, four different boosters, and I know that it's not really a vaccine as much as it is a gene therapy. Where do you stand on that?
Well, from what I know, when they first came out with the vaccines, it
Right.
sounded like it was appropriate to go
Yes.
after a germ and set up a vaccine just like you would for smallpox or polio,
Right.
and it seemed appropriate.
Yes.
With timing, and sometimes the COVID um, germ has changed a little bit, and so the vaccines have become ineffective. Studies have shown that uh, people who have been vaccinated can still get the disease. Um, the only little bit that seems to be good is that some studies show that if you've been vaccinated and you do get COVID, it will be a milder case than if you weren't vaccinated.
What about the people that have died because they took this shot? Now, I know that they were probably at risk in the first place, right?
Well, that's the other point. There have been a lot of complications from the vaccination. Some people have died. Some people have had long-term side effects out of it. So it seemed to have been a hit and miss situation. Um, from
Well, I mean, I
a
was personally amazed how quickly they came up with it. I mean, normally FDA here in America, it takes them 10 years and millions of dollars and research to ever come out with a new drug or a new
Yes,
vaccine.
yes.
And they came up with this like instantaneously, practically.
Well, I think that's a good part. They came up with something rapidly, but
Yeah,
again, the difficulty is that any of the vaccines, they're very limited in their benefit, and again, have side effects themselves.
right. Okay.
So it's a problem.
Yeah, I think it is too. Most definitely. We hopefully are overcoming it. Now, you changed your business um, mission, I guess, from maybe it's not your mission as much as it is, the organization that you had to an online type of consulting. Maybe you can tell us about how that works.
Well, we would have patients come into the clinics 3 times a week. We would check their food intake, give them a vitamin injection, test urine samples, etc., and blood pressures, whatever we needed. When we had to close the clinics down, with patients online, we've taught them how to give themselves a vitamin injection. We've supplied the materials. We've had them go out and buy a blood pressure cuff, which is not expensive, and test their own urines. We teach them how to do that. So we're still getting pretty good response with a patient. It's not the same as physically seeing the patient in front of you and being able to examine them, but it's still extremely good therapy. Now,
All right.
It takes a long time for us to open a clinic, build it, train the nurses how to work there, hire the right physicians, et cetera, et cetera, et cetera. And with closing so many clinics down, and at my age, I don't think we're going to start opening new clinics again, because we found that managing them online is still extremely effective, and we can treat people who can't physically come to the office every day.
You know, that is a benefit, certainly, of COVID, that online people became smarter about how to deliver the information that they're trying to get across. And so therefore we found, well, like in your own case, we can do it online. And you're maybe a lot different than other doctors that, you know, want to bring you into the office type thing. What I didn't realize it till right this moment, and we had a couple of viewers here, and they had some good questions, and so I'm going to post these questions, and I'm going to let you answer it.
Sure.
Mike, we certainly appreciate you. You're an awesome guy. Thank you so much. But he's wondering about, how do you keep lean muscle with so little calories?
Well, see, when you go on a diet, your body breaks down tissue because it's looking for food. We give the body enough food and enough protein to maintain their protein on a nutritional basis. We know from your size and your muscle mass how much protein you need every day. So we put that into the diet, so you're going to have adequate amounts. And we use protein that's basically lean protein, like the white meat of chicken or some white fish, the egg whites, low-fat cheese. We use beef, the leanest cut of beef, but only one serving a week. Only one serving a week of beef. Okay, so we keep things on a low fat, but we provide proper amounts of protein so that they have enough for the turnover of your cells on a regular basis, and they don't get a deficiency. So your lean tissue stays there all the time.
I don't know that he's still with us, but I'll make sure that I reach out and let him know that, because he's the guy that motivated me to do videos like 6 8 years.
Let me give you a nice example. We've had patients that are professional boxers.
Yes.
And between fights, they get careless and they put on 30 or 40 pounds, and then they got to work out to get back into a boxing match. They will come to us. We'll put them on this strict diet. They'll lose the fat while they're working out, and they're ready, and they've got all their muscle left over. And we've had patients, patients that want to do a lot of exercise as well.
I think Mike would really be interested in that information, because he's into fitness. He's he's into videos too with Live Masters, but that's aside from the point. Is that he motivated me to pay more attention to labels of the items that are on the shelf.
Sure.
You know, and when you can't pronounce the ingredients, you know, it's probably not so good. It's probably chemicals. So yeah, he's big time into health. So I definitely want to reach out and make sure that.
And also tell him we have patients who do marathon runs once or twice a year.
Wow.
And they'll come to us to lose weight, 20, 30 plus pounds, while they're doing the marathon runs and working out in the gym all day. So
that's awesome. Yeah, he does. He works out. It seems like when I give him a call, he's running on the treadmill or something. You know, it's like, okay. But he also mentions here about I think it's ultra processed foods are, I think, ultra proud. I'm not sure if that's processed or not. Foods are ultra calorie dense, nutrient deprived. What's your take about that?
Um, I don't prefer a lot of processed foods at all because
Right.
they're destroying some of the natural elements in the food. And so we have recipes for our patients, and we show them how to prepare the foods, simple procedures, so that they don't get foods that have been processed in the stores with a lot of chemicals added to them. And
Mm-hmm.
you're better off without all these extra chemicals, especially when we don't know what they can do. And there's a little more of that coming around now. Food coloring, we found that the U.S. has canned food dye red number 3
Mm-hmm.
because of new information that it may be toxic. And there are many chemicals in the foods that are processed in the US and Canada that they don't allow in Europe. And there's
Mm-hmm.
no need for these extra chemicals to try to flavor the food any better. It's not necessary.
Right. So he also commented that, Ozempic is toxic, and I think I already kind of knew that. And they don't, I think, advertise it for weight loss, but yet that's kind of what it is. I don't know what you're thinking there.
Well, Ozempic is being advertised for weight loss.
It is. Okay.
It is. It started off as being the treatment for diabetes.
Oh,
And then they found that the people who were taking it lost a little bit of weight also.
uh-huh.
So they're pushing to use that as a treatment for obesity.
So do you think it's toxic?
There are significant side effects with it. Patients can get gastrointestinal side effects, nausea, vomiting, abdominal cramps, and pain. But we know that there are, coming out of the woodworks now, possible pancreatic tumors
Wow.
that are created by being on it. But the other thing that's important is the weight loss is very minimal. With Ozempic, they'll tell you can lose 15% of your body weight in a year. So if you're,
Hmm.
so if you're 200 pounds, you can lose 30 pounds, but it takes a year. And half of that, or 40% of it, is muscle. Okay.
Is what?
So your lean tissue, your muscle tissue.
Oh, yeah, right. And you don't.
So you really haven't done a great job. And if you stop taking the Ozempic after the year, you're going to put it all back.
Mm-hmm.
Let
Well, that's
alone the
good.
side effects that come with it. Okay.
Well, those are good things to know because I think a lot of people probably take it because, of course, they're misled by the commercials.
Definitely. And for some people, it's better than doing nothing,
Yes.
only because it helps them start to lose some weight. But once they get into it and see that they can get into a weight loss process, I would take them off the Ozempic and put them on a good, healthy diet regime.
Yeah, it sounds like that's the person that needs to reach out and speak to you most definitely because
Yes.
you've got a lot of experience there, and you started out being a general practitioner as a family doctor, right?
Yes. Yes.
And then you found that there was a real need for the diet aspect, and you got doing that.
I got involved in developing a new diet program. And then my patients who lost weight, their friends came in to my office to lose weight also because they saw their friend had lost weight. What are we doing? And we started treating them. That's why I started with one clinic, then I opened another one to manage a group of other people in Toronto. And then their friends came and their friends came and we just got so busy we couldn't keep up with opening the clinics up. For the first many years, I was managing 11 clinics by myself.
Wow.
I was the doctor running all over the place.
Well, and
But it was wonderful to take patients who have had
mhm.
diseases that were problematic, not just being overweight, but overweight, high cholesterol, heart disease, et cetera, and to get them into a healthy phase. I love doing that in medicine.
See, that's the awesome part too, doctors, is and I'm a believer, I think in most physicians, not all physicians, because I think I've been in the medical industry for a very long time.
Mhm.
Um, and what I found is that whoever like brings the donuts like weekly, what's the drugs that they sell, that's going to be the guy that gets the drug sales and
Yes.
puts it into the doctor. Now you're different than that. I can see that because you care about people, and I believe that that's why you probably became a doctor. Would that be correct?
Yes.
Yes.
I got
And see,
motivated to be able to use your brain and help people get healthier and
yes,
live longer.
see, and I had an argument with a person recently over that, and it's like, not all doctors are bad. And it's like, because he just doesn't think that they are, but it's like, no, that's why they take the Hippocratic oath. Okay, I mean, we're saving people, right? That's the idea.
Exactly. Exactly. And it's such a great feeling to see that patient after they've become healthier.
Yeah,
That's good. Yeah.
that's really awesome, and we really appreciate the fact that you do that for people, and you have helped. Wow, 800,000 people. That's like a mind blower right there.
Yeah, it
Uh,
is.
it truly is. Um, so you're a businessman too, clearly. Um, I think this is a business show, kind of. It's
Yeah.
because we try and just educate the people about what are you doing and how can you do it. But you know what? I'd like to know, what do you do for fun?
Well, I have three sons and five granddaughters
Oh,
I can spend some time with. I like jazz music. I like going out to music venues, and I like traveling as well. Now we just
yeah,
came back from a cruise,
nice.
and I like having to do that. So I
That's
enjoy it.
cool. That's really cool. Yeah, I'd love to travel more. I just haven't got to that point yet. That would be a lot of fun. I know that my parents have done a lot of traveling.
Yes,
Um, so family, it sounds like family is really important to you.
yes, it is very much so. Very
Yeah,
much. So.
it's great having grandkids, huh?
It's wonderful.
It's nice to
All
send them,
girls.
right?
All
You don't
wonderful.
have to have them all the time, but then that's not for everybody. Okay, don't get me wrong here, folks.
No, no.
I understand there's a lot of seniors that are taking care of young infants because of circumstances, and you know
Sure.
what, my hat's off to you on that. I'm serious. I mean,
Thank
really.
you.
Because that's a big deal. Family is super important. um, all right, so we have, I think, what, about 3 minutes or so left. What would you tell the viewers?
Well,
uh,
can I add one more point, please?
Absolutely.
The cost of losing weight could be very substantial. Take Ozempic patients, some of them are using $1,000 a month, and it's going on forever. My patients pay in the range of $450 a month.
Yeah.
And think about losing, we said 30 pounds, 40 pounds. Patients will take a year to do that. That's 12 months of $1,000 a month.
Uh,
Plus, they have to keep on it for longer, maybe 6 or 8 months or a year. My patients can lose 40 pounds in 2 months, and that'll cost them less than $1,000.
wow. See, that's substantial because it's important to take in the whole picture,
Yeah,
not just
so
part of it.
so it becomes available to everybody, and some patients that have insurance programs will even cover that.
uh, yeah, that's cool.
Yeah.
Awesome. Yeah, well, we need to talk after the show for sure about that. Um, that's really awesome. So, what do you feel are the most important things that you would like to leave the viewer with tonight?
Important to know that anybody who's overweight can lose the weight. They just have to be on the right program. They need to be monitored by a physician who knows what to do, especially if they've got comorbid diseases. And they need to try to get all of the weight off, all of the excess fat, which will make them as healthy as possible and allow them to live that extra 10, 20 years without the complications.
Wow. See, that's awesome.
Yeah.
It truly is awesome, and I'm very excited, and I want my family to be involved. And they're on a limited income, so that makes it difficult. But it just sounds like justification for expenditures.
And we try to help our patients and work things out financially.
And what's your health worth, right? I mean, come on, let's get serious.
Exactly.
Yeah, that's an invaluable thing, is to have great health. And that's what it sounds like you do for people. And I really appreciate that you took time out of your busy schedule to come on this show. I would love to have you back if you're interested, and we can share again and let people know that there is an option to being able to lose weight, lose it safely, effectively, and properly. That's really awesome. Thank you so very much, Dr. Stanley
It's
Bernstein.
my pleasure, Stephen. I'd be happy to come back anytime you like.
Ah,
And if patients or friends are calling in with some questions, maybe the next time we can do a series on answering their questions.
that sounds like a great idea. So ask your questions. We're wanting to listen.
I
And I'll
used
tell
to
you
do
what,
I
go
used
ahead.
to do live shows on TV many years ago, on radio stations, and
Ah,
people were calling in, and I would be responding to them, and they loved it, and so did I. A
I just
lot of
tell you,
people like that.
and I tell you, bear with me, folks. We'll get to the point where we can take your call in. That would be so awesome, and that's such a great idea, Doctor. I'm just really super excited. Come back on Friday or next Monday. All right, Mondays and Fridays, 7 p.m. That's when I do this show. We love you. We care about your health, and we want to help you get healthier. We appreciate Dr. Bernstein this evening. Come back Monday at 7 o'clock. You can have the opportunity to meet. Well, he goes by Sherpa, but you can meet Paul, and we'll be talking about Bitcoin and doing what he does. I tell you, it's an investment, but it's a good one. All right. Thank you. Y'all have a good evening.
Thank you. Take
All
care.
right.
Be
Bye for
well.
now.